Mr. Speaker, in the 1940s and 1950s, as we're all now aware, there was widespread nutritional deficiencies among many in the First Nations communities. And the manner in which this was addressed then was completely inappropriate, as we also know. Mr. Speaker, sadly today, under this government, we still have widespread nutritional deficiencies in First Nations people in Manitoba.
And sewer and water.
After 14 years of failure, I ask, what is the Premier's plan to now address these widespread nutritional deficiencies?
Mr. Speaker, in contrast to when the member opposite who asked the question was in the federal cabinet and cut resources to First Nations people in Manitoba, we've put in place prenatal benefits to help families get off to a healthy start. We've put in place nurses that do home visits. We have a community gardening program that a decade ago was 5 or 6 gardens in northern Manitoba, is now over 900 gardens. We just gave a special order of Manitoba to a school teacher from Woboden, Manitoba, which started a gardening program in the school with the residents, the students, and the parents in that school, where they are growing fresh vegetables in northern Manitoba. And we have greenhouses being built in northern Manitoba now. And of course, we continue to work with them on building roads, so when the people need access to fresh food and vegetables, they actually have a road that will take it to their communities, Mr. Speaker.
Mr. Speaker, in the 90s, in spite of the need to address a major deficit, funding for First Nations people was increased. As the Manitoba's NDP's Minister of Health's own Maternal and Child Health Care Services Task Force of 2008 said, vitamin D deficiency and congenital rickets are overrepresented in Aboriginal communities in Manitoba. There is now accumulated published evidence that vitamin D levels in most pregnant women and their infants are in the deficient or insufficient range. That's the Minister of Health's own report. I ask the Premier, will he commit today to community-based programming to ensure that expectant mothers and their children have sufficient vitamin D?
Speaker, that's exactly why Manitoba is the only province in Canada that has a prenatal benefit in place to support young mothers. And that vitamin D research is very important research. As a matter of fact, that research is being done all around the world, but with a focus on how the benefits can accrue to the population of Manitoba. We've got researchers from Israel, Manitoba, around the world working on in a collaborative way to ensure that the nutrients that young mothers and young families need are available to them. But I say again to the member opposite, there was an opportunity when the federal government cut those programs to protect nutrition programs and food programs for First Nations and remote communities, and they did not do that. We have stepped in and worked with those communities to have healthy foods, whether it's fish, whether it's fresh vegetables. And a very important part of that is the roads that we provide in northern Manitoba. The members opposite, when they were in government, the Conservative members opposite did not spend any money on roads in northern Manitoba. They shut them out of the Highway Capital program. We are now building roads so those communities can have access to the goods and services.
First Minister's time has expired.
Mr. Speaker, Dr. Bob Schroth, an expert in child health and preventive dental science, has reported that vitamin D deficiencies in pregnant women increase the risk for tooth decay among their infants. Under this NDP government, we have seen no measurable improvement, either in prevention of early childhood tooth decay or in addressing the widespread vitamin D deficiencies which we know are occurring. I ask the Premier to stop dawdling while this problem persists. I call on the Premier to stand up for First Nations people and Métis people and address this vitamin D deficiency today. Will he?
Mr. Speaker, we have raised the Northern Food Allowance 7 times in Manitoba, and the member opposite has voted against it every single time. We put in place a prenatal benefit. The member has voted against it every single time. We have a Northern Food Program, Northern Gardening Program, and Greenhouse Program. The member has voted against it. If the member is serious about making this a priority, I invite him to vote for the budget, because we have more resources to look after northern populations in the budget, Mr. Speaker.